Thyroid symptoms or hypothyroid symptoms, but always being told that everything is normal, your thyroid's fine, there's nothing to worry about. I'm naturopathic Dr. Emily Lipinski. This happened to me for years, and one of the main reasons that my thyroid disease was not properly diagnosed at the beginning was because not all the thyroid tests were run. So I'm going to outline all the thyroid tests and the full thyroid panel that I run on all my patients that come to me with thyroid symptoms such as thinning hair, always feeling cold, constipation, always feeling tired, puffy face, puffy neck, and also some of the potential nutrient deficiencies that could be contributing to the issue or perpetuating the issue. So number one is TSH, thyroid stimulating hormone. This is what is typically run in conventional practices when thyroid symptoms or hypothyroid symptoms are present. However, often is the case that I see in my patients that that's one of the only thyroid tests is done. So I run that one, but I also run T4 hormone and T3 hormone, which is really important. We want to make sure that there's adequate T4 hormone and that all that T4 hormone is also being converted to T3. T3 hormone is the active thyroid hormone. It is what is going to help keep your metabolism up, keep you feeling warm, keep you feeling energized. And some people are poor converters of T4 to T3. So we want to check into that. And you can actually look at a thyroid ratio, a T3 to T4 ratio. So you divide the T3 by the T4. You want that ratio ideally to be over 0.33. Then I'm looking at both thyroid antibodies, so TPO, thyroid peroxidase antibody, and TG antibody, thyroglobulin antibody. These antibodies, if they're elevated in the early stages, sometimes the TSH still looks normal, but people can experience hypothyroid symptoms. I believe this is what happened to me for the 5 years prior to my TSH finally changing, that I most likely had elevated thyroid antibodies, but no one looked at those. So I'm looking at both of those antibodies and making sure that they are negative. There is something called reverse T3 that I do run in some of my patients, especially patients that are very, very stressed, or patients that fast a lot or have had a history of a lot of fasting and something's going on with their thyroid, but I don't run the reverse T3 on everyone. Now, I'm looking at nutrient deficiencies, especially looking at iron stores, which is ferritin, that is just a marker of your iron store, and looking at vitamin D. Low vitamin D levels are actually can be highly correlated to low thyroid function. Someone that has autoimmune thyroiditis, Graves or Hashimoto's, may be more likely to have low vitamin D, and optimizing vitamin D levels may help with thyroid symptoms. It may also help lower thyroid hormones. So pretty much on every patient that comes to me with hypothyroid symptoms, I'm suspecting thyroid disease, or they have pre-established thyroid disease, but they're still not feeling well, I am looking at TSH, T3, T4, TPO antibodies, thyroglobulin antibodies, vitamin D, and ferritin levels. Let me know if this was helpful in the comments below. I would love to hear from you.